ਗੁਰਜਿੰਦਰ ਗੁਰਜਿੰਦਰ ਮੈਂ ਤੁਹਾਨੂੰ ਪੁੱਛਣਾ ਚਾਹੁੰਦੀ ਹਾਂ ਕਿ ਜਿਸ ਤਰ੍ਹਾਂ ਤੁਸੀਂ ਮੈਂਟਲ ਹੈਲਥ ਦੇ ਵਿੱਚ ਹੈਗੇ ਆ ਮੈਂਟਲ ਹੈਲਥ ਪ੍ਰੋਫੈਸ਼ਨਲ, how you balance your life with with your daily routine and your family life and your your job, and because you are a director of pharmacy, it must be very, very stressful job, so I mean, how you balance it?
Anji, it's a good question. It's not a straightforward answer. So when everything is working fine, when there's no problems, it's okay. But ਜਦੋਂ problem ਹੁੰਦੇ ਆ in mental health, they're normally quite serious problems. So if we've had patients who have died from overdoses, when we have patients who have maybe not been treated in a way that worked well for them and they've gone and done something, they might have hurt themselves or another patient, where we have patients who maybe have had accidents because they're taking medicines that might make them drowsy. So any sort of serious incidents, then I have to get involved as part of the investigation. So sometimes in getting involved with coroner's reports, working with the police and working with regulatory bodies as well, so that we can see what happened and to see if there's things that we can learn. But that takes up a lot of time, a lot of stress, a lot of late nights, and sometimes there's nothing we can do about it. Sometimes it's because maybe the right thing wasn't done at the right time, but then sometimes that's a resource problem as well. It's very difficult. So we have to, writing reports is very stressful, especially when it's a very difficult case, when people have died, when somebody's been injured. Thankfully, it's very uncommon, but it does happen sometimes, so it can be quite difficult. Sometimes we have patients who commit suicide, which is very difficult as well. It does happen, but thankfully we try our best. But we are an underfunded mental health organisation, like all of them. It's very difficult to keep services safe 100% of the time, and it's very difficult to kind of manage everybody. Mental health is very common now, and I think it's recognised much more, and I think especially with young people as well. I think life is hard for young people, so I think there's a lot of pressure and stress even at school age for some children that maybe is different to when we were children. So I think that's difficult too. So there are some. It is difficult to balance family life, but it's one of those things. I think it's an important role. Yeah.
So Amar, if I know Amar is also in mental health professional, because ਸਾਨੂੰ ਜਿੱਦਾਂ ਮੈਂ ਸਮਝਦੀ ਕਿ NHS ਦੇ ਵਿੱਚ ਜਿਹਦੇ 'ਚ ਤੁਸੀਂ ਕੰਮ ਕਰਦੇ ਆ, ਉਹ ਤੁਹਾਨੂੰ ਸਪੋਰਟ ਕਰਦੇ ਆ। ਜਿੱਦਾਂ ਹੁਣ ਮੈਂ ਦੂਸਰੇ ਕੰਟਰੀਜ਼ ਦੇ ਵਿੱਚ ਦੇਖਦੀ ਆ, ਉੱਥੇ ਜਿਹੜਾ ਸਟਾਫ ਹੈਗਾ ਆ, they get lots of facilities, like they can go for counseling. They provide them counseling, psychotherapy, free of cost for their NHS staff, and they send them for massage and other therapies as well. There are lots of positive things I see there, in Canada as well. ਇੱਥੇ ਕੁਛ ਏਦਾਂ ਦਾ ਹੈਗਾ ਹੈ, ਆਪਣੇ ਸਟਾਫ ਦੀ ਕੇਅਰ ਕਰਦੇ ਆ NHS ਵਾਲੇ ਕਿ ਨਹੀਂ?
ਹਾਂਜੀ, ਸਪੋਰਟ ਹੈਗਾ, ਪਰ it's ਥੋੜਾ ਜਿਹਾ ਬੇਸਿਕ ਆ, ਜਿੱਥੇ system is a bit more basic. So ਇੱਥੇ well-being services ਹੁੰਦੇ ਆ. So every few weeks or every month we have one-to-ones ਜਿਹੜੇ like with my boss. My boss is the chief medical officer of the trust, so he's on the board. So we have monthly meeting hunde. So if I say I'm really stressed, I'm having some problems at home, I'm not feeling well, I'm having problems, ਫਿਰ ਉਹ refer ਕਰ ਸਕਦੇ ਸਾਨੂੰ to occupational health. So from there, occupational health, they have doctors as well, nurses and doctors. For report page, their manager says, yeah, we think you should have some counselling sessions or some time off work, or we can't send people for massages or anything, but there's talking. We can do wellbeing services and counselling. Normally it's those sorts of things. Or if it's medicines, then there's reports. If I'm very stressed, then I might say he needs to see his GP for something, because in mental health, working in mental health, we're more susceptible to having mental health problems because it's a stressful environment, but also physical health problems because working in mental health is also physically dangerous. If we're working on the wards, especially, so if I look at my team, the people most vulnerable in my team is probably my female members of staff. In hospital, most pharmacists are female. It's kind of well known. So most of my staff who are on wards delivering clinical services, they're females. So if they're working on a male ward with lots of men who are not mentally very well, there's some risks there. And also working in women's wards is very dangerous too, because women can also have violence and aggression problems too. So violence and aggression is quite a problem is a big problem for us in the NHS. So as well as the mental risks, there are physical risks too. So there are incidents up and down the country where medical staff have been physically assaulted. It's not uncommon. It is a criminal offence, obviously, but it happens. That doesn't happen quite as much in acute. So if you've got a ward full of people having hip replacements, you're probably not going to be assaulted. But in a working age mental health ward where people are physically fit and they're confused and they're having side effects and they're not happy, or they've been sectioned, or they're away from their friends and family, then there's more risk of physical problems as well, people being injured. So we have to be careful. So when we're on the wards, sade alarm hunde. So if there's a problem, or if we're in the room with a patient, we could trigger the alarm. Everybody comes to support. It's not very often, but we have to, as well as providing the care, we have to look after ourselves as well. So we have to be careful in the environment to make it safe. But we have very good support for that. We're generally very well protected.
And there's employee assistant programs, isn't there, where staff can obviously access all the talking therapies, and if they need time off, then it would go to the occupational health, wouldn't it, in the UK? But I think self-care is quite important, isn't it? Having a routine of work-life balance. It
is important to balance it, but we don't always have to speak to the managers either. We can just directly refer ourselves to occupational health. So some things we might not want to talk to our manager. It might be even a problem with that manager. But so there's other people we can talk to. The NHS, in terms of well-being and support and talking and things like that, is very good, to be fair. What's difficult is just the length of time that sometimes people have to wait for counselling, because anyone providing any sort of expertise in that area it's like gold dust. It's hard to kind of get people. So that's the only downside. But it's a nice facility to have, at least for people who need it, and certainly people within my team have used it, so it's very useful.
Yeah, that's good. And I wanted to just touch on really the care for people with additional needs, so SEND cases, disabilities, and elderly care. So ਜਿੱਦਾਂ ਆਪਾਂ ਦੇਖਦੇ ਹਾਂ care homes ਦੇ ਵਿੱਚ ਜ਼ਿਆਦਾ ਹੁਣ elderly ਬੰਦੇ ਜਿਹੜੇ ਆ ਕਾਫੀ ਆ living on their own. Their families ਕੋਲੋਂ ਨਹੀਂ ਸਾਂਭ ਹੁੰਦੇ because they have so many additional needs. When you're doing joint meetings in hospitals, whether it's medication discharge meetings, ਤੁਸੀਂ ਫਿਰ ਉਹਨਾਂ ਨੂੰ invite ਕਰਦੇ ਆ ਜਿੱਦਾਂ the key people that have nominated themselves?
Anji, so when it's a lot of these are social issues, so there normally has to be a package of care. So when somebody is with us for a period of time and they've had lots of changes to their medicines, and they're going to be going home, we have to make sure not only are they medically fit and that they've got their medicines, we have to make sure the environment they're going into is safe and that they're going to be looked after, because otherwise they're just going to end up being admitted somewhere else again and maybe worse off. So there's lots of delays with this sometimes, because sometimes support needs to be put in place. So we have to involve occupational therapists sometimes here to make sure that we can step people down safely back into their home place, or even getting back to work. So we employ teams of occupational therapists in a lot of our mental health teams. So we have physios and mental health OTs within our teams who play a really important role. So that's one part of it. The second part of it is difficult because sometimes the children don't live with their elderly parents, and that's becoming more of an issue now, even within our Punjabi community as well. Sometimes the children get jobs far away from home, and then the parents are at home, and it's quite difficult. But we will normally try to, where the patient wants to, we can normally bring in family members to be parts of that conversation to make sure we can provide that package and make sure it works for them. But it is a problem which is probably going to continue to get a bit worse over time. And there's the care homes are limited in space as well, so that's a difficulty. And then the cost of care as well is a big problem. So the social care issue is a big financial problem for the government and for people really. So
So Gurjinder, what is your strength and weakness as a director of pharmacy?
Oh God.
If you don't mind me asking.
Strength and weakness. I think okay, so one thing about pharmacists, we have attention to detail like nobody else. So we look at every full stop, we look at everything's got to be perfect for a pharmacist. So we definitely are perfectionists, because when we're checking prescriptions or checking dosages, we are milligrams, micrograms, grams, we are so accurate. We don't make mistakes with those sorts of things very often, because our job is to stop the mistakes that other people make. So accuracy is a real strength, I think, of mine, but probably all pharmacists. Weakness, I think probably, I don't know if the workaholic, I don't know. I always want to keep learning, and I should probably stop because I don't like learning, but I keep wanting to learn. So I start learning something and then I'm like, why did I do this? I don't have time. But I just keep going and I don't know why I do it. So I regret starting something, but I always finish everything. But sometimes I think I should just chill out a little bit. But maybe that's a strength and a weakness in one. I don't know.
Okay. So you are allowed to, like, if you feel that this medicine is not appropriate for a patient, so you can change you can talk to the GP and you can tell them that they can change the medication, or they should change the medication.
In hospital, pharmacists, the job thoda different hunda hai. So we've got more power. We can change prescriptions if we need to. We can. So in a shop, they can't really change much very easily. Legally, they have to get the doctor to change it. In hospital more now, so I've got prescribers in my team. We can prescribe medicines, or we can discuss something with the team and we can prescribe it, or we can change things within reason for the right reasons. फिर जेरा patient the notes ਹੁੰਦੇ ਆ ਉਹਦੇ ਚ ਫਿਰ ਲਿਖਣਾ ਪੈਣਾ reason ਅਸੀਂ ਕਾਹਤੇ change ਕੀਤਾ, what was the problem. So it's all full record keeping of why we changed it, who changed it, who did we speak to, what did the blood test say. So we have a lot more power, but there's more responsibility. We have to make sure everything is done the right way, because it has to be done safely. So it's been that way for a long time. But we don't just change, everyone doesn't just change things. It's a very controlled process. You have to be very careful with this. And then we audit as well. So audit we got there, and so we check in, making sure that everything's safe. This month, how many medicines in errors did we have? How many mistakes were there? How many were no harm? How many were serious harm? And then ਜਿਹੜੇ serious harm ਦੇ ਹੁੰਦੇ ਸੀ, ਫਿਰ ਅਸੀਂ ਉਹਦੇ ਥੋੜਾ ਇਨਵੈਸਟੀਗੇਟ ਕਰਕੇ ਦੇਖਦੇ ਆ ਅਸੀਂ ਇੱਥੋਂ ਕੀ ਲਰਨ ਕਰ ਸਕਦੇ, ਫਿਰ ਦੁਬਾਰਾ ਨਾ ਪ੍ਰੋਬਲਮ ਹੋਈ ਜਾਂਦਾ every month. So we always trying to learn. So, and when we learn something, we try to share it. So we share it with all of our team. So if I make a mistake, everybody can learn the lesson together. We all discuss it. It's a no blame culture. So if somebody makes a mistake, we don't blame the person. It's your mistake. You're in trouble. We don't do like we all make mistakes. We are all humans. But as long as we all try to learn from it, this is the best way. This is one of the great things about the NHS. We have a good culture of learning from mistakes. So it's one of the strengths of the NHS is that we have that.
Nice. ਅਮਰ ਤੁਸੀਂ ਆਪਾਂ ਜਿਸ ਤਰ੍ਹਾਂ ਆਪਾਂ ਅਮਰ ਵੀ ਮੈਂਟਲ ਹੈਲਥ ਪ੍ਰੋਫੈਸ਼ਨਲ ਹੈਗੇ ਆ, ਤੁਸੀਂ ਵੀ ਮਤਲਬ ਫਾਰਮੇਸੀ ਦੇ ਵਿੱਚ ਮੈਂਟਲ ਹੈਲਥ ਪ੍ਰੋਫੈਸ਼ਨਲ ਹੈਗੇ ਆ, ਤੁਸੀਂ ਕੀ ਐਡਵਾਈਸ ਕਰੋਗੇ ਜਿਹੜੇ ਆਪਣੇ ਜਿਸ ਤਰ੍ਹਾਂ ਸਟ੍ਰੈਸ ਮੈਨੇਜਮੈਂਟ ਦੇ ਲਈ ਜਿਹੜੇ ਥਰੂ ਸਾਡੇ ਜਿਹੜੇ ਪ੍ਰੋਫੈਸ਼ਨਲਸ ਜਿਹੜੇ ਆ ਕਾਫੀ ਜ਼ਿਆਦਾ ਇਸ ਟਾਈਮ ਲਾਈਕ ਬਿਕੋਜ਼ ਮੈਂਟਲ ਹੈਲਥ ਇਜ਼ ਔਨ ਦਾ ਰਾਈਜ਼ ਸੋ ਐਜ਼ ਏ ਫੈਮਿਲੀ ਤੁਸੀਂ ਆਪਣਾ ਜਿਹੜਾ ਹੈਗਾ ਕੀ ਐਡਵਾਈਸ ਕਰੋਗੇ, ਕਿਸ ਤਰ੍ਹਾਂ ਮੋਟੀਵੇਟ ਕਰੋਗੇ ਜਿਹੜੇ ਹਾਰਡ ਟਾਈਮ ਚੋਂ ਲੰਘ ਰਹੇ ਜਿਹੜੇ ਇਸ ਟਾਈਮ ਜਿਹੜੇ ਆਪਣੇ ਸਟਾਫ ਹੈਗੇ ਆ ਜਾਂ ਪ੍ਰੋਫੈਸ਼ਨਲਸ ਹੈਗੇ ਆ ਜਿਹੜੇ ਹਾਊ ਦੇ ਕੈਨ ਲਾਈਕ ਆਪਣੀ ਸਟ੍ਰੈਸ ਮੈਨੇਜਮੈਂਟ ਕਰ ਸਕਦੇ ਆ?
Anji, okay, so first thing, staff or not staff, we all have GPs, so we can contact our GPs for support. Family members, talking to family members about stress are important Jija, for support. We have to share our problems if we want to get help. We can't keep it inside. Even within in our Punjabi community, there's a taboo of mental health. It's better than it was. I mean, when I go through all of our wards, we've got so many patients from our community there, which is, it's good to see because it means that people are coming in, but it's obviously sad to see. But we need to share that physical health problems like having a heart attack, having cancer, having a shoulder surgery should be seen the same way as having depression, having psychosis. It shouldn't be seen as higher or lower. It's called parity of esteem. It should be given the same importance. Because mental health it should be seen the same way as physical health. There's nothing wrong with it. People have problems. We all have difficulties in life. Everybody does. So we need to talk to people. The problem is getting professional counselling or psychology support. There can be some waiting lists, but that early help early on can help prevent having to take medicines. If we're waiting too long, then sometimes the problem can get worse for badi janda, and then we have to fir dawai da zaruri penda, which is not as good. So if we can sometimes prevent the problems getting worse, then that's better. But there are medicines to help too. And then we have for professionals. So I don't know about with nurses and with medics, but we have professional associations as well. So they will help with people who are having hardships. So most professions will have that as well. So there's that as well as the employer as well. So we have NHS support for that wellbeing services. So there's lots of different ways to get help for professions. It's a stressful time, so there is a lot of.
It is. It is, yes.
And I'd just like to add to that. I think when when we're seeing clients as therapists, it's really important if they've come through the EAP program or they are private paying clients, that if they are taking medication, it's really important that they tell the therapist. If they have a diagnosis, it's also just as important. And if they need diagnosis, then we will make sure that we have all the assessment tools, that we work alongside their GPs to make sure they have all the support that they need. So that is really important. Early care, I think, is the main thing. Look, we're Punjabi, there's a massive community in England all over. Now, I'm not saying we can all relate to it. We can't, especially when we're in times of stress. But making sure that if you have got a pharmacist that you can trust and go and speak to, if you can't get a GP appointment, that is really crucial. Like, the pharmacist can open so many doors for somebody. Sometimes you just don't realise that actually they're there and I can speak to them. They can look at your records. They can actually advise you quite well. Also, things like going for walks, right? And taking time out, balancing your diaries. If you're working online all day, having that break. If you've got children, small children, and you're working and juggling too much, it's again that balance. It's trying to ask for help and trying to get help, and childcare at school after school clubs, breakfast clubs, even asking, co-working with other parents. It can help you, I think, really, really well. On top of that, it's about really, I think, working with the professionals that we have. We've got so much support in the UK. Just alone, Gurjinder mentioned a couple of things to us about translation services, and the NHS is so big and they do have resources that we don't need people for. They're online as well. So I think signposting is a good thing too, isn't it?
Absolutely.
Thank you, Gurjinder. ਤੇ ਲਾਸਟ ਦੇ ਵਿੱਚ ਮੈਂ ਪੁੱਛਣਾ ਚਾਹੁੰਦੀ ਹਾਂ ਕਿ ਤੁਹਾਡੇ ਜਿੱਦਾਂ ਤੁਹਾਡੇ ਕੋਲ ਕੋਈ ਕਿਹੜੀ ਹੋਰ ਹੌਬੀ ਹੈਗੀ ਆ? I know you are a professional pharmacist. ਕੋਈ ਹੋਰ hobbies ਜਾਂ ਕੁਝ ਕਰਨਾ ਚਾਹੁੰਦੇ ਸੀ ਜਾਂ ਨਹੀਂ ਕਰ ਸਕੇ, and you still have that dream and hope that one day you will learn that or you will achieve that, or any hobby or anything you have?
Professionally, I'm happy with how much I've done. I think that probably when I have a bit more free time, I want to do more charity work. I think I want to get involved in more charitable stuff. So we've done some work with I've done some work with CCAID and things before as well. So I want to do a bit more work with that. But then also, I think just it'll be nice to spend a bit more time with my family when I have a bit more time. And other hobbies, I don't know. I'd like to do more reading again. I think I spend a lot of time reading professional articles, but I think I'd like to do more reading for enjoyment, but I don't have time for too much reading, especially with 3 small children. I have 5-year-old twins, which keep me very busy, and a 7-year-old son. So when I get home, it's a very noisy household. It's like coming home from work and coming to a zoo when I get home. So it's lovely, but it's not a peaceful environment with 3 children. But yeah, so
Yeah, nice to know talking to Gurjinder today.
So thank you for your time today. It's been really,
Thank
really
you so much,
It's been very
Gurjinder. Thank you so much. Thank you
okay.
so much.
Pleasure
Sat
to
Sri
join.
Akal ji. Thank you.
Sat Sri
Sat Sri
Akal.
Akal.